Let's go ahead and jump to the next one. All right, so I'm so glad that I'm following Carrie because she's done such a great job of introducing the proactive traffic safety approach and all of the things. And as we looked at it in Washington, we wanted some local Washington data, and we wanted to know where we were kind of, what behaviors are ripe for growing and where do we have the majority of people doing it right, and we can tap into those people and have them help us. So in Washington, observational seatbelt surveys show 93% of us are wearing our seatbelts, better than the national average. 91% of people are keeping their focus on the road. And then with some self-report survey, statewide surveys, we've discovered 78% of people report they don't drive after drinking, and 85% don't drive after using cannabis. So we can see that we have some really good, strong, positive traffic safety behaviors already going on in Washington. That's a whole lot of allies we think we can help enroll in helping us reach those smaller percentage of people that are having trouble doing these behaviors correctly. So go ahead and next slide. And the best, most happy one for me, when we question people, we find that 74% of people already agree that the only acceptable number of deaths on our roadway is 0. So next slide. I think there was a question about intervening or engaging bystander behavior. And one of the things we found out about our surveys when we asked was that of the people who found themselves in a situation where they might want to intervene, half of those people already reported that they intervene, that they do take that chance and do intervene. So there's a lot of people out there who have already prevented a ton of possible impaired driving trips. And I think that's such a strong thing to say. I know that Richard was curious about people not wanting to say something because they're afraid they'll be assaulted. And we've really worked on kind of modeling the behavior where you can have a pretty easy conversation about it. You can do some pre-planning around it. And if it's a situation where you feel like it's dangerous, there's other steps you can take. You can enlist other people to help you, and you can even call 911. So there's a lot of intervening behaviors that can happen that we're showing up in these surveys. So we're really happy about that. At the Traffic Safety Commission, we've been building proactive traffic safety into our actual programming. So this past year, all of our program managers took classes with Jay Otto and Katie Dively to help them understand the framework and proactive traffic safety. And we worked on crafting strategies that involved theories of change and logic models, which really help us think about how we're working, building evaluation into our programming. And we're taking all of this that we're knowing, we're on the edge of really building program plans that think about and work across the social ecology. And that's something we haven't done before, but it's a really exciting way to start thinking about what can we be doing to help schools? What can we be doing in workplaces? What can we be doing around policy and law enforcement? And there's just a lot of partners for us to reach. So when we start thinking about these individual behaviors we want to grow, we're really starting to think now about who are the partners in the room that we can start tapping into to help them promote traffic safety as well. I don't know if you're familiar with portfolio mapping, but that's one of the places where we're mapping out our strategies to see who they're impacting and what social ecology level we're working in to help us understand that. So one thing that we've been working on in traffic safety policy realm is workplace policy. And we, of course, I think it's always good to start with your self-reflection. Where am I at in all of these things? And where's my workplace at in all of these things? So, for example, at the Washington Traffic Safety Commission, we've worked hard on our distracted driving policies for our employees. So one of the things we felt was really important for people to know is that nobody wants you to be working while you're driving. And that means even if I happen to make that phone call while you're on the road or your boss is making that phone call, we don't want you to pick it up. And we make that really clear so that nobody feels like, oh, I know I don't want to drive and be distracted, but it's my boss calling, so I better pick up. We also make it clear that it's not enough to just follow Washington's law, which is hands-free. We really want people to just not be diverting their attention from the road when they're driving. We want focused driving on our road with our folks. This summer, we noticed that, as everyone was working from home and we were a much more mobile workforce, that occasionally we might see someone joining our calls while they were driving. And so to discourage that, we quickly went out with a statement that's being put on all of our agendas when we're holding a meeting. And it says, Washington Traffic Safety Commission encourages everyone to keep their focus on the road while driving. Please don't join this meeting if you're behind the wheel unless you're parked in a safe location. So, it's just, that's a little bit of bystander intervention and pre-planning to help people know that what our expectations are. And we will say something to someone if we see that they're driving during the meeting and ask them to disconnect from the meeting and come back when they're safe. We also put that message out to partners, asking all of our partners to include these types of statements on their agendas as well. And I've sent it up to the governor's office to ask them to encourage more state agencies to recognize this need that we might have to multitask and try to nip it and make it clear that that's not what's expected. We're also developing workplace distracted driving toolkits. We're in the process of building out the website and looking for businesses that are willing to pilot this training with us, and we're excited to see where that goes. But these are some examples of how we're thinking across that social ecology with our programming. Go ahead. So when I was in my breakout, one of our other members was talking about not knowing how to measure the educational efforts that people were doing. He was talking about the 4 E's and not knowing, like with engineering, we know we can do this treatment and we have studies that'll show it will reduce crashes by X amount. So when I started in the Traffic Safety Commission under the communications piece, we did a lot of, well, that seems good. We'd go out to a contractor, tell them what we wanted, tell them what the issues were. They'd come back with something and we'd be like, oh, okay, that's fine. But as we've explored with this culture for the Center for Health and Safety Culture, what's really effective and what's grounded in research, we've pretty much tossed out that approach completely and moved towards something that we feel we can measure because there's this framework of science behind it. So as we've been working on communications, we've gotten to the point where we just recently launched our new initiative called Together We Get There. And it's really about balancing concern with hope. So we're not going to pretend that there aren't horrible consequences that are happening on our roadways that need to stop and that we're very concerned about them, but we're also balancing that message with hope. We think we can bring people around to help us do the right things, that we can make these changes, and here's how we can do it. We're tapping into that universal value that Carrie was talking about to begin with. And we're using data, which is such a joy to me to be able to have things that we can measure about our campaigns when we go out with them. And we're identifying those gaps. So one of those gaps might be, I intervene when I see someone about to drive impaired, but I don't think many people do. So as we can narrow that gap to help them understand that, most people are, and build more people doing it, more people will feel comfortable doing it. So one of the things I'm asking myself every time we go out with a new PSA is, who's my hero here? And I can look back at ads we've done in the past, and the hero might be the person who's not doing the behavior right. That's the person who's getting all the attention and moving through the ad, even if it's a negative hero. We're really asking ourselves, how are we demonstrating the behaviors that we want people to take up? How are we showing the proactive traffic safety activities that people can engage in and helping to grow that behavior so that we're doing it more? Go ahead. We call it the less scare, more care approach, and I have to give Doug Dahl credit for coming up with that phrase. Scare tactics can normalize risky behaviors. They can invoke those feelings of loneliness and despair and shame. So if we, are putting out a commercial where somebody who's an impaired driver ends up being the bad guy, or we make fun of them, and you're somebody who has a substance use disorder, you can end up feeling like there's no hope for you. There's no way to reach out. So we don't want to be moving that. We don't want to be admiring the problem. And we really have stopped using any images of death or destruction, because people can be re-traumatized by that. And that's not something we want to take part in. So that's kind of our philosophy around it. Go ahead. As we were developing this approach, we used some focus group testing to find out how we were doing. And this slide and the next one are just make me so happy, because we asked people in the focus group to think about the historical traffic safety ads that they'd seen. And then we showed them this emotion wheel. It's a little bit hard to see, but it really uses these base emotions of anger and sadness and joy and love and fear and surprise. And we asked people, the behaviors roll out from there to be a little more specific. And what we came back with was this hot area of people replying to us in the realm of feeling insecure or anxious or nervous or dread or horror about the ads that they could remember. And we know that when people become afraid, and when they're in fear, we elicit these fight or flight emotions coming at them. So that's not a great place to be learning or educating someone. Next slide. After we showed them our concepts, we gave them another feeling wheel, and we see that hot spot really rotated around to the areas of joy and surprise, hopeful, enthusiastic, optimistic, proud. And that is really the space we want to be working in when we're pulling into people's emotions. The examples that Carrie showed us do that really well. The Embrace Love commercial, it's really about giving people a good place to be learning about things instead of this fearful place. So if they work, I'm going to show you a couple of our PSAs that we've developed underneath this brand of Together We Get There. The first one is just a launch of this whole campaign thought. So hopefully this will work.
Something amazing happens when you buckle a seatbelt. It's kind of magic when we put our phones out of reach, or give extra room for someone on their bike. That little act of stopping to let someone cross the street is a thing of beauty. Even getting a ride home after drinking is quite heroic, because it's all the little things that play a big role in keeping us safe. Together, we get there.
So this one was really about kind of setting the stage for the rest to come. We'll be looking at using each PSA under this brand to trigger a different type of behavior that we want to encourage in people. So the next one that we created was a distracted driving PSA. I think if we go to the next slide, did you already do that? No, next slide. You're there. Okay. So this one was focused on the one behavior of asking someone not to use their phone while driving.
Want to drive?
Really?
Most of us agree our roads are safer when we put away our phones. But we still have some people to reach. So spread the message. And set the example. Because that's how we make the road a safer place for you and your loved ones. Together, we get there.
So those are just two examples of how we'll be managing our communications moving forward. We'll have things that we can actually ask. We're setting up statewide surveys so that we can track if we're changing beliefs or attitudes about this. And I'm super excited that we're there. Carrie, back to you.